Hello, how is everybody out there? Thank you for tuning into our channel. Our goal is information. We want to help Medicare members out there understand their coverage and make sure they're on their best plan. There's a lot to Medicare, so we want to talk about, each thing as it's needed. If you have a video idea or request, just leave it in the comments or message us. We'll be more than happy to help you. The Medicare Review Department is on Google at g.page /getmedigap. So we're going to open our book here to page 69. If you can see that right there. And we're going to talk to you about a little secret that maybe the insurance companies don't want to let get out too much, okay? Everybody knows that Medicare as a general rule, or should know anyway, Medicare as a general rule will cover 80% of your health costs, okay? And what most people do to cover the 20% that Medicare does not is get what's called a Medicare supplement plan. Okay, that'll cover the 20% that Medicare does not. All right, anywhere you go, you put your card down and you're covered. Now, what you may not know and what we want to make you aware of is this. All Medicare supplement plans, okay, are 100% regulated by Medicare and the U.S. government to be exactly the same. If you'll see right here, halfway down the page 69, when we're in the Medicare and You Handbook, which is the official guide to benefits for Medicare members. It says Medicare right here, Medigap policies are standardized, okay? Be sure and check this in your book. It's just right there in print. If you need a copy, we'll send you a copy. You get one each year as a Medicare member. Certainly, you can see it on Medicare.gov. But it says Medigap policies are standardized. Every Medigap policy must follow federal and state laws designed to protect you, and they must be clearly identified as Medicare supplement insurance. Insurance companies can sell you only a standardized policy. Okay, what that means to you is that Medicare supplement plan that you bought when you turned 65, no matter who it's with, whether it be AARP or United, Mutual of Omaha, Blue Cross Blue Shield, Bankers, you name it. There's usually about 40 different companies that offer Medicare supplement plans per zip code. They're all the same. So the only difference is the price. So if you've gotten a rate increase on your Medicare supplement, let's say you got it when you were 65 and you got a plan G for $70. So that plan goes up as a percentage of your premium once a year, depending on the state. You can pretty much count on a rate increase. If you're healthy like most Medicare members, it may be the only time you even talk to your company. Okay, so they send you a rate increase every year, and of course they're doing a good job. You know, the Medicare companies, they make a lot of money. Medigap policies are a smart move, but they get more and more expensive as they go. What you may not know is that if you've been relatively healthy the last couple of years, most all companies will offer you what's called a discounted premium because of your good health, okay? There's 4 questions to qualify. They are as follows. In the last 2 years, have you had a heart attack or a stroke? In the last 2 years, have you had an internal cancer diagnosis? Are you diabetic? And even if you are diabetic, if you take like metformin or something of that nature, or just control it with your diet, you still qualify for the healthy rate as long as you don't take more than 50 units of insulin a day. So if you're a no to that, the last question is, do you have a respiratory illness like COPD or something of that nature that would require oxygen on a daily basis? So let's go over these again very simply. No heart attack, no stroke in the last 2 years, no internal cancer diagnosis in the last 2 years. If you're diabetic, you need to take less than 50 units of insulin a day, and the last one is not to be on oxygen daily for like COPD or something of that nature. If you can say no to those 4 questions, chances are you qualify to keep the exact same plan you have now for less money. So if it's gone up from $70, it's now up to about $125, $130, $140, $150, whatever it may be. Some of those Plan Fs get up over $200. That's too much money. Most of the people that we work with are on fixed incomes, and it doesn't matter who you go with, because if you'll notice right here, 100% standardized. So give us a call. It's 501-625-9878. You can find us on Facebook at the Medigap Monkey, and we want to help you. So thank you.